National Registry of Emergency Medical Technicians. Advanced Level Psychometer Examination. Intravenous Therapy. Checks selected IV fluid for proper fluid, clarity, expiration date. Selects appropriate catheter. Selects proper administration set. Connects IV tubing to the IV bag. Prepares administration set, fills drip chamber and flushes tubing. Cuts or tears tape at any time before venipuncture. Takes or verbalizes appropriate PPE precautions prior to venipuncture. Applies tourniquet. Palpates suitable vein. Cleanses site appropriately. Performs venipuncture. Inserts stylet. Notes or verbalizes flashback. Occludes vein proximal to catheter. Removes stylet. Connects IV tubing to catheter. Disposes/verbalizes proper disposal of needle in proper container. Releases tourniquet. Runs IV for a brief period to assure patent line. Runs IV for a brief period to assure patent line. Secures catheter, tapes securely or verbalizes. Adjusts flow rate as appropriate. If candidate did not establish a patent IV within 3 attempts in 6 minutes, do not evaluate the candidate in IV bolus medications. Critical fail criteria. Failure to establish a patent and properly adjusted IV within 6-minute time limit. Failure to take or verbalize appropriate PPE precautions prior to performing venipuncture. Contaminates equipment or site without appropriately correcting the situation. Performs any improper technique resulting in the potential for uncontrolled hemorrhage, catheter shear, or air embolism. Failure to successfully establish IV within 3 attempts during 6-minute time limit. Failure to dispose/verbalize disposal of blood-contaminated sharps immediately in proper container at the point of use. Failure to manage the patient as a competent EMT. Exhibits unacceptable effect with patient or other personnel. Uses or orders a dangerous or inappropriate intervention. Intravenous bolus medications. Asks patient for known allergies. Selects correct medication. Assures correct concentration of medication. Assembles prefilled syringe correctly and dispels air. Continues to take or verbalize appropriate PPE precautions. Identifies and cleanses injection site closest to the patient, Y port or hub. Reaffirms medication. Stops IV flow. Administers correct dose at proper push rate. Disposes/verbalizes proper disposal of syringe and needle in proper container. Turns IV on and adjusts drip rates to TKO/KVO. Verbalizes need to observe patient for desired effect and adverse side effects. Critical fail criteria. Failure to continue to take or verbalize appropriate PPE precautions. Failure to begin administration of medication within 3-minute time limit. Contaminates equipment or site without appropriately correcting the situation. Failure to adequately dispel air resulting in potential for air embolism. Injects improper medication or dosage, wrong medication, incorrect amount, or pushes at inappropriate rate. Failure to turn on IV after injecting medication. Recaps needle or failure to dispose/verbalize disposal of syringe and other material in proper container. Failure to manage the patient as a competent EMT. Exhibits unacceptable effect with patient or other personnel. Uses or orders a dangerous or inappropriate intervention.